Because it is going to be a very enlightening section for musculoskeletal system.
पारुल, आपने लिपस्टिक नहीं डाली, कुछ तो आप में मतलब एक वो
बिंदी बिंदी मिसिंग।
वृंदा जी हम ऑनलाइन हैं, लिपस्टिक मैंने न्यूड लगाई हुई है और बिंदी आज मैंने नहीं लगाई है।
थैंक यू पारुल फॉर द क्लैरिफिकेशन।
जी थैंक यू वृंदा जी फॉर योर काइंड कंसर्न।
होली शिट।
ये हमारे दर्शकों के लिए है, तो आज अच्छा हुआ आप लोगों को हमारा ऑफलाइन इनसाइट भी थोड़ा सा मिला। ये गर्ल्स का चिट चैट है, चलता है, इट्स ओके।
अच्छा एडमिट कर दें क्या सबको?
जी जी बिल्कुल
ठीक है यार।
वृंदा जी, डॉक्टर वैद्य हमारे साथ आ जाए तो आप मुझे बताइएगा, हम लोग स्टार्ट कर देंगे।
I think with the name of Palak Vaidya, if sir is there, sir, can you unmute and say hi?
Yeah, it is sir. He just changed his name. सर ने अभी चेंज किया अपना नाम, उनको जो है
Yeah.
हेलो हेलो
हेलो सर।
गुड इवनिंग डॉक्टर। वेलकम।
Am I audible now?
Yes, sir.
Yes,
You
sir.
are audible.
बहुत अच्छी तरह।
So once again, if you say hello, voice is little echoing kind.
Mine?
Yeah. Now it's better.
Okay.
Sir, Brinda here. आपको मैंने I've given you the rights to share your screen. So अगर आपसे हो सके तो great, नहीं तो we will do it for you in case there's any issue. Thank you.
Hello, ma'am.
Hi, Sahib. Brinda ji, shall we start?
Yes, please, let's start. Thank you.
नमस्ते दोस्तों, मैं पारुल और आपका स्वागत करती हूँ हमारे शनिवार के सेशन में, जिसमें कि हम मिलते रहते हैं और अलग अलग इशू जो डाउन सिंड्रोम ब्लेस्ड पर्सन से रिलेटेड हैं आपके साथ डिस्कस करते रहते हैं। आज हम एक बहुत ही महत्वपूर्ण विषय पर बात करने वाले हैं जो जुड़ा हुआ है हड्डियों से। ऑर्थोपेडिक सर्जन डॉक्टर पीयूष वैद्य हमारे साथ हैं और उनसे आप बिल्कुल आपके मन में बहुत सारे सवाल एकदम आ गए होंगे, मैं जानती हूँ, तो आप अपने उन सवालों के जवाब भी सेशन के एंड में उनसे ले सकते हैं। उससे पहले सर आपको अपनी तरफ से जो एक प्रेजेंटेशन है वो देंगे, उसमें बताएंगे, तो मुझे लगता है बहुत सारे आपके सवालों के जवाब आपको वहां मिल जाएंगे। जो भी आपके सवाल हो वो मैं आपको सलाह दूंगी कि आप साथ साथ लिखते चलेंगे तो बहुत अच्छा होगा, ताकि सेशन के एंड में हमारे पास ज्यादा से ज्यादा समय हो आपकी क्वेरीज को लेने के लिए। दूसरी बात मैं यहाँ बताना चाहूंगी कि आप जो भी हमारी सेशन होते हैं इनमें आपके बच्चे से या आपके सेल्फ एडवोकेट से रिलेटेड जो भी इशू आपको आते हैं उनको आप नोट करते चलेंगे तो बहुत ज्यादा अच्छा रहेगा, उस पर आप बेहतर काम कर पाएंगे। सेशन के एंड में आप अपने सवाल या तो हमें चैट बॉक्स में भेज सकते हैं या आप अपने आप को हैंड जो आप करके अनम्यूट करके पूछ सकते हैं। तो दोस्तों बहुत ज्यादा समय ना लेते हुए हम कार्यक्रम को आगे बढ़ाते हैं और डॉक्टर पीयूष वैद्य जो एक बहुत ही काबिल डॉक्टर हैं, बहुत ही हैंडसम पर्सन है, उनके स्वागत के लिए मैं इनवाइट करती हूँ समीक्षा को, मेरी दोस्त समीक्षा।
Yes. Good evening, everyone. Very warm welcome in today's session. And yes, as my friend Parul rightly mentioned, I too hope that you sit with your pen and paper, ready to take notes of your reference from the information we are going to get in the next 40-45 minutes, because it is going to be very enlightening session on issues related to the musculoskeletal system, health of muscular system of persons with Down syndrome. And our invited guest today is an institution in himself for the concern related to this area. He will guide us and also suggest about how to manage and when to intervene. We feel very honored and privileged to have Dr. Piyush Vaidya with us. He is the leading orthopedic surgeon in Navsari, Gujarat, and runs his own hospital, which provides relief to the people with their orthopedic problems. He has the vast experience of almost 3 decades. His entire family is involved in working for and serving to the people with special needs. In fact, it won't be wrong if I call him the second part of the second generation clan of his own clan who have dedicatedly working for the cause of Down syndrome. Yes, parents, join me in extending a very warm welcome to Dr. Piyush Vaidya, father of another very capable successor, Raj, and our super champ self-advocate Palak, and life partner of our dear Dr. Neena Vaidya. Sir, over to you. We all are waiting to learn and take guidance from you.
Thank you for your very kind words. Actually, what you said today, that I am going to say something about the orthopedic problems. Actually, what you all see daily in the mirror, I'm just going to give you the X-ray view of your body today, right? So can I share the screen?
Sir, please. By then, I would request all the participants to please switch on your videos. Yeah.
Can you see this thing on your screen?
We can see.
Huh?
Yeah. You have to just enlarge the screen. That's it.
Okay, I'll do that. Now, can you see?
Yes, sir.
So today, see, this is all an interactive session. It is not that I am expert on this. Every one of us know by far what the orthopedic problems our children have, because we have been seeing daily, day in and day out, from morning to night, since they get up in the morning until they sleep. We all see them very closely, what problems they have, what happiness they have, what issues they have. But to throw some medical aspect to you, I'm going to give you some information regarding this. So I am Piyush Vaidya. I'm practicing orthopedic surgeon. Largely, I'm doing trauma and joint replacements, but I do some work for the children and adults with Down syndrome, just because of my daughter Polak and Nina have been doing extensively work for this community. So what we all know is it is one of the most common genetic disorder. See what happens, the children with Down syndrome have developmental delays and medical problems, but it varies from person to person. See, they have got medical problems in the whole body. Actually, Down syndrome community is not spared. What a normal person can have the disease or disorder, they all suffer from that, or they can suffer from that. It is not stamped that they suffer from that. So many of our children, they are very healthy, they do not have any issues, or if at all they have got issues, they are very small, or in quantity, or in matter, or in treatment wise. So mainly, many of the children, they suffer from heart problems. They have got some stomach issues. Then they have got some eye problems. When their bones are involved, there comes my role. Musculoskeletal system. It is involved because these children and adults have very low tone, muscle tone. They have got hypotonia, and the ligaments and muscles around all joints, they are so loose. We label them ligamentous laxity in our tongue. I think you all are well versed with the language English, or shall I speak in Hindi also?
Sir, English, they all understand. The English you are saying, they all are able to understand. The question
yeah.
comes in Hindi, you can very much answer in Hindi, sir.
So what we commonly observe in children and adults with Down syndrome, there it is joint dislocations, because the ligaments are very lax and the muscles have very low tone, right? The main problems, like, see, there are so many problems in these children that can occur. One is genu valgus. First, we will start from the head and spine to all the lower limb. It is just a few enumerations so that you get into the subject. I have just put into these words for getting you all involved in the subject. I will explain you what is genu valgus, what is overpronation, what is pes planus. I'll explain you everything, right? When these children grow up, after the age of, actually a normal person suffers from osteoporosis. Females, they suffer after 45, 50, and males, they suffer from osteoporosis after say 60 or 65 or 70. Down syndrome community is associated with greater risk of osteoporosis after the age of 25, 30. Why? I'll tell you. Now we will take up region-wise what orthopedic issues these children and adults can have. Atlanto axial instability. Atlanto axial instability means it is related to the first and second vertebra here in the cervical region. It is related to first and second vertebra. First vertebra is known as Atlantis and the second is known as axial. So when the ligaments are loose between these two vertebrae, it is known as Atlanto axial instability, that is C1, C2 vertebra. Approximately 10 to 30% of the individuals from Down syndrome, they suffer from this. However, most of them are asymptomatic. What symptoms they can have? See, when the joint is loose, it is not tight. Ideally, the vertebra should be like this, but because of the ligamentous laxity, it tends to, one vertebra tends to move forward like this. So because of this, what can happen? They can suffer from neck pain. They can have torticollis, means this type of neck. Torticollis is this type of neck diverted to one side. Then because of the cord compression, their walking stance changes. They can have even changes in the pattern of urination and defecation. So bladder and bowel control are compromised, and a type of paralysis may set in. This is not true for every individual. This can happen theoretically, right? The muscle and the ligaments that support the neck part from behind them, so potentially the compression, and that can lead to muscle weakness, that can lead to numbness, that can lead to limping gait, or say very difficulty in propagating oneself from one place to other. Spinal cord compression does not occur in most of the children with neck instability, but the progressive physical changes in a child with Down syndrome, that should to notice not only to the doctor, but the parents should be alert each and every day, say from the birth to 10 years of age, right? So weakness, walking with stiff leg, stiff neck, neck pain, headache, all these things can occur. Now see, this is number one vertebra, this is Atlas, and this is Axis, right? Can you see the cursor? Can you all see this cursor? This is C1, that is Atlas or Atlantis, and this is the second vertebra, that is known as Axis. Now when this moves forward, or this goes backward, that is known as Atlanto-axial instability. How this can be diagnosed? The child is taken for X-ray, head flexed and extended positions. See, when you can see this flexed position, bent forward and bent backward. So in this position, the vertebra translates on the other vertebra, that is known as atlanto-axial instability. See, can you see this? This gross instability here?
Yeah.
Yeah. So how do you evaluate and how do you manage? As I told you, get X-rays screened. When the X-rays, when a child needs X-ray, when he or she is suffering from neck pain, radicular pain in either of the limb or all the limbs, then muscle becomes spastic, means very rigid, very tough, walking difficulties, and hyperreflexia means when you touch the elbow, these hands goes like this. That is known as hyperreflexia. When the child is having difficulty in passing urine or stool, that or muscles lose, walking difficulties, then this X-ray should always be taken. MRI can also be done to evaluate the level of instability, that how much one vertebra has translated on the other one. If at all the child is suffering from weakness, numbness, then he should be considered for surgery. But surgery is fixation, stability of the joint, but not before the age of 10. Now scoliosis and kyphosis, this part we have completed. Now we'll go to the other region of the vertebra. What is scoliosis? Scoliosis is very common in persons with Down syndrome. It is curvature of the spine on one side. If I show you, I'll show you. I have this. See, when this curves like this, it is scoliosis. This is scoliosis on one side. It can happen on other side as well. This side or this side, right? What is then comes kyphosis. What is kyphosis? Kyphosis is hump on the back. It is our upper back is rounded. That is known as kyphosis. Treatment of kyphosis and scoliosis is very risky because it deals with the spinal cord from top to bottom, and this deformity needs a gross correction. See, this is scoliosis. Can you see this now? The body part. This is scoliosis. See the X-ray of this scoliosis as I showed you on this model. Can you see the curvature here?
Yes.
Yes. Then, if at all patient is having quadriparesis or paraparesis or paraplegia, this type of surgery has to be done. This is an extensive surgery, but very risky too. It may give results, it may not give results. This is a figure of scoliotic curve. And can you see this kyphosis?
Yeah.
This is just for the demonstration. See this kyphosis, and this is without kyphosis, and this is with kyphosis. Now we go down. Spondylosis and spondylolisthesis. Spondylosis means loss of calcium from the vertebral body, leading to lipping and thickening of the vertebra, that we call is spondylosis. And spondylolisthesis is slipping of one vertebra over the other. Here, in spondylosis and spondylolisthesis, in Down syndrome, we may see such symptoms very often. Patients, they suffer from pain, they suffer from radicular pain in the legs, and they need treatment. See, this is, can you see this lipping here, 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 this is all spondylotic changes. And when in the second figure, if you see one vertebra going forward onto the other, this is known as spondylolisthesis. This needs treatment. Again, when patient is suffering from more pain, difficulty in walking, not able to sit for a longer time, and then they need medical as well as surgical treatment later on in their age. Then we come to the hip joint. See, hip instability is very, very common. The prevalence of hip, see, according to the data, 1 to 7%, 1 to 7% is quite a high ratio. If you take ratio statistics data, then 7% is a high rate. And that can result in progressive loss. Patients can become morbid because they are not able to sit cross-legged, they are not able to squat, they are not able to walk. So the cause of hip instability is because of hypotonic muscles, because of ligamentous laxity, and many times because of abnormal hip morphology. What are abnormal hip morphologies? I'll tell you. I have all the figures for you to understand. So the initial presentation seen in children less than 2 years is delayed walking and generalized muscular hypotonia and ligamentous laxity, leading to hypermobile. If you see the children, many children, they sit and sleep with all their hips spread wide apart. That is all due to they are just like the wings of the plane. So many of our kids, they sleep like this initially when they are born till the age of 2, 3, 4. But we cannot label them as their hips unstable, because that is because as such also they have hypotonia, as such also they have got ligamentous laxity, but we have to investigate for it. So as soon as we'll see what we can do, how we proceed. From 2 to 8 years, hip instability progresses to either subluxation or dislocation. Joint can come out of. I have got all models, so it would be very easier to understand. See, this joint, this is the hip joint. When it comes out like this is subluxation. When the whole head is behind, it is dislocation. When the whole head is behind, it is dislocation. Finally, in adolescence or later or early adulthood, they can have fixed dislocated hips. See, this is the X-ray of, can you see this head out? Can you see this head out? So this is hip dislocation. When even some children are born with congenital means since birth, dislocation of hip, what we call CDH. They need extensive treatment. From the day one, they need extensive treatment to keep their heads stable in the socket, here in the socket, right? So this is the figure, so you can understand it better. Now, what the abnormal hip morphology we just saw, this is coxa valga, means coxa means hip and valga means outward. So when the femoral, this is somewhat towards the outer side, that we label is at coxa valga. And acetabular retroversion means when the cup is like this, retroverted like this, then also it cannot contain the head inside. So that is how they can lead to these hip dislocations. Coxa valga is reported in 2/3 of adults in Down syndrome. How to manage this hip instability? Management of hip instability largely depends on the age and phase of unstable hip. For patients under 2 years of age, no treatment, matlab no operation, only conservative. They are given splints, they are given. For older patients with habitual dislocations without the socket, with normal socket, Our goal is to stabilize the hip and prevent secondary changes in the socket, right? What are the secondary changes? That socket may go into another version, and that can lead to even a deeper hip dislocation, or even the socket can break and the head can go move in the pelvis. Patients with fixed dislocation may require total hip replacement in a later age, but that is again very risky. It is not at all rewarding due to low muscle tone and ligamentous laxity, because however the joint is replaced, but the holding muscles to those joints, they cannot keep the joint in position. So that is how it is very difficult for the patient. Post-operative care is very difficult, right? Slipped capital femoral epiphysis. What is femur? I'll show you. This is femur. This is head. What is epiphysis? Epiphysis is a growth hand. When the child is small, his height is day by day increasing. So there are growth ends in the bone. At the top and at the end, there are growth plates. They increase. That's how the bone increase. So when the femoral head growth plate, it slips in the socket, that we call it as slipped capital femoral. Capital means head, femoral epiphysis. I'll show you the figure. Can you see this?
Sir.
This capitus is slipped. This is normal. Even this is slipped. This is very common with patients having hypotonia and ligamentous laxity. This needs emergency pinning. Otherwise, this will not reduce. You cannot give plasters to such patients and you cannot get results. Then another common problem is kneecap instability, patellofemoral, what we call this. This is kneecap. This is kneecap. Can you see? This is kneecap. And you see the I'm here in yeah. This is kneecap. Right.
Yeah.
So the prevalence of patellofemoral instability is around 10 to 20%. Patellofemoral instability is rarely painful, but they can fall frequently, they can have limping gait, they can have pain. And this particular disability or instability, it is very common. Some I'll show you the picture also. I'll show you the picture. See, can you see this going outward? This kneecap can be subluxated here. This is dislocated here, or even it can dislocate further. So it is divided into mild, moderate, and severe category. However, non-operative treatment is the best thing because of hypotonia, but surgery is needed in many patients. I have also done surgery in two such patients. The kneecap was normal till 2 years after surgery, but as soon as they started running because of hypotonia, that patella again dislocated. So we had to give plasters, series of plaster to keep the patella or kneecap in the position. And now, after this long treatment, she is somewhat better. Pes planus, or what we say flat foot. Foot and ankle deformities are very common, and they are around 30%. So common is pes planus means flat foot, hallux valgus means outward going of the great toe, outward going of the. I'll show you all the pictures also. As a result of these conditions, patients, they have got poor foot control. And 2 studies have shown that around 76 to 90% of the patients of Down syndrome, the pes planus pain and the pes planus, they persist into adulthood also, and they need treatment for such flat feet now and often. See, this is normal arch. This is flat foot. Most of our children, they have this. Most of our children. How do you treat them? See, numerous non-operative treatments have been described, including heel wedges, heel cups, shoe inserts, and custom-made shoe orthotics. They are very helpful. See, this even you can ask the child to walk in sand. As soon as the child starts walking, and if he or she is suffering from flat foot, we advise them to walk in sand to get their arch developed, because they have got this flat arch and we want to have this arch like this. So, but unfortunately, very few patients, they have their normal arches back in the normal thing. Most of them, they need inserts, they need heel wedges, they need custom made shoe orthotics. And these orthotics, they do not counter the course of flat foot, but the pain which they have due to their flat foot, this wedges and arches and inserts, they help a lot in relieving the pain of this. See, this is the support, medial wedge. This is the medial wedge. So that this medial wedge helps the foot to be in the normal arch position. They like this. Hallux valgus. Hallux means toe and valgus means outward position. I'll show you. See, this is hallux valgus. This is also very common. Outward going toe. This, because of this outward going toe, this we call it bunion. It is not an overgrowth of the bone. This is the normal bone. It is in the normal position, but this great toe has gone to the other side. So that is known as hallux valgus. And this great toe leads to other toes also to go in valgus position. But the good part is that in our children, all the deformities are fully correctable. They are not rigid as in normal persons. So I'll tell you what physiotherapy can help. Hallux valgus is reported in around 10 to 60% of the patients with Down syndrome, and related to all structural factors like metatarsus, varus, flat foot, ligamentous laxity, tight heel cords. In children with Down syndrome, hallux valgus can be associated with foot-specific disability during school and play activities and the use of narrow-fitting footwear. That is also the factor that is associated with increased disability. How to manage this? It is mainly non-operative. Orthotics, I'll show you the pictures of the orthotics. That is, see, manipulation. If you see, if this is the great toe, and if it is moving outward, the manipulation is just to bring it to the normal position or beyond the normal position. When the toe is out, you bring the toe in. Because of hypotonia and ligamentous laxity, the manipulation is very easy in our children. So you are able to balance the muscles and tone many times, right? See, these are the splints. These are hallux valgus splints. This will keep the toe in because it was going out. Now, because of this splint, it has come in the mechanical axis, right? So these are different types of splint. And time to time, when the children, they suffer from hallux valgus, and when they are in the growing age, time to axis of the splints, they change and you have to change it. Another common deformity is bow legs, what we call genu varus. These are bow legs, right? If you see the mechanical axis in a normal patient, it starts from center of the hip to center of the knee to center of the ankle. But in varus, you see center of the hip, then it comes to the inner side of the knee, and it goes to the lateral outer side of the ankle. That is how they suffer from pain, they suffer from walking normally, their gait is not normal, right? See, these are splints to counter bow legs. These are bow legs and these are splints to counter. They are all adjustable and you have to move your knee in the opposite direction of the deformity. Genuvalgum, knock me. This is the other side. What we saw first, varus bow, it was in, this is outward. So you see this axis and you see this axis. Now here what will happen? Center of the hip, outer side of the knee and inner side of the hand. The whole axis changes. So that is how patients are not able to walk in a balanced way. Splinting you can do and you can the deformity, but this is not 1 day, 1 month time treatment. It is ongoing treatment for years together, right? So summary, we see what we have seen: Atlanto axial instability. You take the X-rays. Treatment depends on the degree of instability. Just observe, avoid the activities, gross normal activities, or some patients they may need fusion, as I showed you the X-ray of the fusion there. Atlanto occipital instability also needs this kind of fusion and treatment. Now, spondylosis and spondylolisthesis, although they are very symptomatic, most of them they need only non-operative treatment. They do not need surgery, only medication, physiotherapy that counters everything. For hip instability, as I told you, according to the age, it starts from non-operative, then surgery, depending on the phase of instability. But again, I'll point one thing, that surgical interventions in these children is absolutely very, very skeptical. We don't expect good results because of the hypotonia and ligamentous laxity. Slip capital femoral epiphysis, yes, we reduce the things, do the pinning. And so one more thing, that in slip capital femoral epiphysis, this particularly occurs in Down syndrome children who have hypothyroidism. This is very common. It might be a coincidence, but every patient we see of slip capital epiphysis, he or she invariably has hypothyroidism. For patellar or kneecap instabilities, mostly non-operative braces, surgical options, as I told you, it's very results are not encouraging, but still for some years they can give good results. So we do surgeries for that. For flat foot, non-operative shoe where you can modify your shoe. Orthotics, they are very helpful since birth, so we can do that. And helix valgus, as I showed you, all the splints and all that, they are very helpful. Now, I would make one point very clear. Nina has also been telling me since years together that ever since you know that your child is born with Down syndrome, early intervention, manipulations, and physiotherapy can prevent so many orthopedic issues. How? See, as soon as you start doing physiotherapy, all the muscles which are hypotonic, they tend to get developed in time. When these children are born, we see they are just like cotton, very flabby, very flabby. But as soon as they start doing physiotherapy, their muscles, they start getting tired. And let me inform you all that there are no drugs at all for development of muscles. Only physiotherapy, only exercises. If we don't talk or don't label physiotherapy, exercises. Because physio would be a very heavy word that, oh, it's a medical treatment. It is, physio is not a medical treatment. It is day-to-day exercise schedule that we call physiotherapy. It is not a therapy, but it is the mandatory thing in our lives. Even a normal person need a mandatory thing, like exercise to live better. Occupational therapy, as we all know, all gross motor skills, all communication skills, all related sensory thing, occupational therapy. And that is, see, all these therapies, we don't need to search out everything. Parents can be the best physiotherapists. Parents can be the best occupational therapists. What we normal persons do, we just let us allow or let us propagate our children to take part actively in all the normal daily activities, right? So that is very, very important. Uh, Orthopedic issues, largely these are the common things which I have taken, and orthopedic segment is almost complete. But to bring to your notice, hypothyroidism and cardiac problems are also very severe in children and adults with Down syndrome. So as soon as we see some problem, just seek the advice of a medical personnel so that they do not suffer more, right? And with all that, thank you for your kind attention. I have just taken all the major issues that we come across in our orthopedic specialty, right? And
Yeah.
this is all.
Thank you so much, sir, for that good overview about the problems related to the orthopedic aspect of a child. And we have lot many questions floating in the chat box and one hand raised. So I would request Vicky, if you can unmute yourself and ask question.
Hello, everyone. Hello,
Hi.
ma'am. Piyush, sir,
Yes.
just a general question. You mentioned about that hip. Just a minute. I'm just removing that. Yeah, scoliosis, what you mentioned. Yes, sir. I mean, the picture I see is more of a, I mean, the hip, what you call disalignment, is a permanent disalignment, or is it momentary, or, you know?
See, as I told, this scoliosis, the normal curvature, when the spine curves to one side, it is called as scoliosis.
Okay.
See, the best part in children and adults with Down syndrome is that all their ligaments and muscles are so loose, they are all fully correctable.
Okay.
So manipulation. See, if a child has scoliosis, what we have to do is manipulation. Like जब हम उसको नहलाते हैं तो एक थोड़ा ऊपर से और दोनों एक सर से और एक पांव से थोड़ा मैनिपुलेट कर सकते हैं.
Right, sir. Right.
They grow up, we can ask them to do this vrukshasana and all that, so that their spine needs stretching. Their spine needs to be stretched. So the curved spine, which is like this, that gradually comes in a normal position like one bend.
Okay. But sir, the photo which is it's a permanent disalignment, or
when
it's a permanent?
When this scoliosis tends to be there till the adolescent age, yes, then it can be permanent, and then if any neurological symptoms develop, he or she needs surgical correction.
Okay, okay. So it's a permanent thing. Okay. And one question, sir, regarding the just a minute. Regarding the toe outward, what was it? Helix valgus.
Yes.
Sir, I mean, about that, my question was, as you said, it also because of the narrow footwear, it increases the disability, or it creates more difficulty for our kids, the narrow foot. But sir, if I have seen a few kids, their toes, if we don't bring them narrow, they're pretty spread out. They have a wide toe. Many a times their toe is very wide. So is that also not a problem? I mean,
see, narrow shoes, I tell you, narrow shoes is one of the propagating factors for foot disability.
Okay, sir.
So what we do, what we suggest, that if you allow your child to wear a narrow shoe, if he or she goes to school, they have to follow.
Yes, sir.
We advise that you put in either a sponge or a cotton roll in between first and second toe, so that
Yes, sir.
the toe
Yes, sir.
which is going outward, that
Yes,
can
sir.
come to the normal or slightly to the normal side.
Okay, sir. Okay. Understood, sir. Understood.
And first and foremost thing, do not ever forget to manipulate any of the disability or unstable part. If it is, you just remember the simple principle, the deformity is going out, just pull it in. If the
Okay,
deformity is in, just pull it out.
Noted, sir. Noted. Thank you. Thank you, sir. Thank you.
And not that too, not very hard or very, because life is very soft. Our children are very soft, so we have
Right,
to be
sir.
soft. Right?
Absolutely. Absolutely, sir. Thank you. Thank you, sir.
समीक्षा,
I would like, हाँ, yes, Parul.
आगे बढ़ने से पहले मैं बताना चाहूंगी डाउन सिंड्रोम फेडरेशन ऑफ इंडिया की प्रेसिडेंट रेखा रामाचंद्रन जी हमारे साथ हैं। तो मैं जानना चाहूंगी उनसे, अभी रिसेंटली जैसा कि हम सब जानते हैं बबली को काफी बड़ा एक प्रॉब्लम आया है, ऑर्थोपेडिक इशू ही था, और जो आज का हमारा प्रेजेंटेशन रहा है, और डाउन सिंड्रोम ब्लेस्ड पर्सन्स के साथ जो ये इशू है इनके बारे में मैं रेखा माँ के अनुभव जानना चाहूंगी।
Namaskar, Piyush bhai, thank you so much for your
hello,
absolutely enlightening, and I've learned so much just through your conversation and your presentation. It really made a lot of sense. I just want to ask you, Piyush bhai, that at any stage of their lives, they are vulnerable. So I just want parents to understand what is it that we have to be a little careful about. We make our children dance on stage. We make them use, the trampoline. We need to know what is it that we have to be a little more cautious with children, because we just came back and Bubbly had a ligament tear.
Okay.
So is that common? And is because we know that there is a ligament laxity in their system. So why does this happen, and how can we prevent it?
Yes. See, what we have to focus is, see, if we talk about Bubbly, she has got a ligament tear, which knee joint? Hello?
Sir? Yes, sir.
Rekha, Bubbly has a ligament tear in knee joint?
It is on the left knee.
Left knee, yeah. See, what we have to understand.
I can't hear you. Your voice is breaking up, actually.
Rekha, sir's screen has frozen. We have lost his voice. Piyush, sir, can you hear us?
Okay.
Yeah.
Okay, because it's raining very heavily here also. So I might lose the connection also. So, yes, I'm just trying to understand what you're saying.
Yes, I think he might join once again, because I can't see him on screen now. Brinda, can we just sound sir to?
I don't know where sir is, so maybe we could just call him once.
Brinda?
Yeah, tell me, Sammy.
Can we request sir to join again? I think he is logged out and he'll be joining again soon.
Yeah, maybe. When he comes in, anyway, we'll invite.
Yeah. So let's really wait for him to come back with
maybe
us.
Ma could share her experiences, no?
Rekha ma'am, by then we would like to hear from your experience.
Yeah, so my question is, we know what Piyush bhai has just told us are all the facts. Now, we need to know prevention. So, we never thought that if you dance on stage or you're jumping on stage, you can suddenly crack something, and we don't know whether they will not tell you easily, because some of them are not that verbal. So we need to understand what is it we should stop at a certain stage, because, after the COVID, we found out from a lot of people that osteoporosis is a very common thing that is happening. Also, during the menopausal stage, I think a lot of women are also having bone issues. So I would like Piyush bhai to make a note of all the things that we can prevent to keep our children, safe, because, they love dancing, they love jumping, they love to be on stage. Is it okay, or do we, restrict their movements? Also about yoga, what is the extent of the damage that can happen by constantly, stretching the way they are doing, because their bodies are very flexible.
Yes.
And is
We
it
have-
okay? Yeah. Okay, Piyush, fine. Now you take over.
See, one thing we need to understand. Actually, I lost my connections. I'm joining through my phone.
Yes, sir.
One thing we need to understand the physiological axis. If we understand right from the top of the head to the tip of the top of the to toes, tip of the toes. See, the axis is absolutely in the middle, right? But because of this hypotonia and because of the lax muscles, because of their short stretcher, the bones, each and every bone is also not of equal size. Even if the right knee might be smaller or bigger than the left one. That also we have seen. So because of these flabby muscles, because of the ligamentous laxity, if they walk in one stance all the time, they are not likely to suffer from any of the ligamentous or muscle tear. But to bring to your notice, if they start walking fast, if they start running, if they start dancing immediately, this type of injuries can always lead to ligament tear. And it is also not one-time issue. If this happens now and often, then the small tear, which was incomplete in the initial phase, that can take the shape of the full tear later on.
Okay. Thank you so much. I got the point.
And what I always insist for such children and adults is that when we know that this is the inborn thing which they can suffer from, while doing gross active activities like dancing or walking or running, Palak is going to do marathon running now and often, but I always ask her to wear a brace in the knee joint so that her joints are not damaged.
Okay.
So when we allow them to go for dancing, when we allow them to walk fast, make sure that our children they should wear braces to protect their joints. And in children after say 30 years, the osteoporotic changes they are likely to set in. The arthritic changes they are likely to set in because of it is a normal function that God has made in that. So supplementation of calcium and all that is okay, but the routine lifestyle we have to see accommodate according to the age, accommodate according to the body structure, and accommodate according to the capacity of the individual child.
Yeah. So weight also is a huge issue, isn't it, Piyush bhai?
Yes.
So,
yes.
Yeah.
The obesity always plays a major role. And
Right.
I have seen, I advocate in all children and adults, pranayam and yogasana, they help a lot. See, pranayam, if you see these Kapalbhati or say Prastrika or Nadi Shuddhi, they allow their center to be aligned. So when the center is aligned, you know the thinking pattern, what we set in, where they are all just like God, subconscious mind. What you feed in, they are going to execute it immediately. So when we know such thing, we feed regularly the good things, the positive things in them, so that, because see, our subconscious mind also, it doesn't understand jokes, neither our children.
Right.
They only will talk, they only will think about the present moment, and they only will think about only the present thing which they want to do.
So true.
So what I insist is that yoga, pranayam, they help a lot. They even, if you see Surya Namaskar, so Surya Namaskar is a complete exercise in itself. If one does 20 Surya Namaskars a day, no other exercises they are needed.
Right. Agreed.
And if Surya Namaskar is done along with the rhythm of the breathing, it adds to that.
Okay.
And one simple principle for Surya Namaskar is when you go down, you exhale. When you come up, you inhale. This is the basic principle which we all need to follow, and we need our children to follow such basic principles. And once they are taught, it is permanent in them. They cannot forget them.
Yeah. True, I agree with you. Thank you so much, Bhai. You've really sort of opened our eyes on a lot of issues. Because one thing about ophthalmology, or I'm talking about orthopedics, is that we rarely find people who understand the subject. Because I know that Palak is there. You must have done an extensive study on all of this, and that the least discovered subject is always orthopedics. Because and it's the most important, I feel, and we give importance to everything else, but we never add that onto our list of checklist. So we talk about it at birth and then we forget about it. But thank you so much. I think that the parents have definitely, and we will add this onto our website, because I think it's so important for everyone to understand that we have to have the right type of bones, the structure, the capacity to walk right to the end and be healthy. Thank you so much, Bhai. Thank you so much.
Thank you.
Coming back to questions, I will take one question from chat box now, which is an extension of Vicky's question. It is about scoliosis only. Sir, the parent wants to know that the daughter Ashi, it's from Dr. Nidhi Gupta. She says that Ashi has scoliosis and it is progressive in spite of spinal brace. So can you throw some light on that, sir?
Yeah, Nidhi, let me tell you that this Vrukshasana and Yogasana can help a lot. Because what we need to do is that we need to stretch the spine. So for stretching the spine, I'll definitely send you some pictures of spinal stretching. I do have the pictures and I can send you across. I know Nidhi, she is a dentist in Delhi. Yeah. So Nidhi, don't worry. I'll send you the pictures of spinal stretching, and that will, with brace, do not forget, with brace. Brace is not the treatment, it is just a support. But the treatment we need is stretching, manipulation, yoga, pranayama. And that will definitely help. I guarantee you that it will not progress.
Yeah. So another question related to another kind of scoliosis. I'll take this. Then I'm coming to Shikha to ask. This says it is from Ramada's screen. It says that, hello doctor, my daughter Anita Menon, 29 years, is diagnosed with idiopathic sclerosis. What treatment would you suggest? If I have pronounced it correctly. Piyush sir, can you hear us?
Yes.
Yeah, we are losing your voice. It's not very clear right now.
I can hear you. I can hear you.
Yes. So we can't hear you.
Hello.
Hi, sir.
Hello.
Yes, sir. Boliye, sir.
Hello. Can you hear me? Can you hear me?
Now we can hear you, sir.
Acha, is that idiopathic scoliosis?
Yes, sir.
Yes. See, idiopathic scoliosis is, most of the time it is always idiopathic. Idiopathic means the one where we don't know the cause of that particular deformity. That is, idiopathic means the cause is not known. For any scoliosis, because of the injury, because of the lifting weight, or because of the spasm, because of the disc lesion, because of the neoplastic lesion in the spine, however the cause may be, only one thing which needs to be addressed is correction of the deformity. So how old is she? Can you tell me how old is she?
29 years. 29
See,
years.
29, this cannot be corrected fully. Although their muscles are hypotonic, that cannot be, but braces along with stretching and yoga and pranayama can definitely limit her deformity to some extent only. It will not progress.
Okay. Okay. Shikha, if you are hearing, please unmute yourself and go ahead and ask question.
मेरा क्वेश्चन है कि जब भी मैं इसे एक्सरसाइज कराती हूँ या फिर मसाज मालिश करती हूँ इसकी या कपड़े भी पहनाती हूँ ना, तो चट चट की आवाज आती है इसके हाथ से पैरों से। तो ये किसी चीज का सिम्टम है, मतलब कुछ क्या प्रॉब्लम है?
See, I tell you, these are normal things because their joints are loose. Joints are loose because of the muscles and ligamentous laxity. Joints के आजू बाजू में जो muscles आते हैं ना, वो बहुत loose रहते हैं. तो क्या है कि जब आप मालिश करते हो तो जो joint है वो थोड़ा stretch होता है. जब stretch होता है तो वो जो ligaments हैं वो भी stretch होते हैं. So there is a gas that is produced in the body which give rise to such sound. But those are normal sounds. You do not worry about that.
Okay, thank you.
Yeah. Sir, then Sarika wants to ask that my daughter Charvi, 9 years old, always complains about the pain in a tip of right toe. Any suggestions for that, sir?
Pain in tip of right toe.
Yeah.
Does she her toe is normally aligned?
Sarika, if you are there, can you unmute and tell?
Yes, it is a normal line.
Then you don't need to do anything. Just give hot water or say lukewarm water massage. You can, even if she has got more pain, you can give some analgesics. That's it.
The same thing we are doing. Yeah, thank you, sir.
Yeah.
Yeah.
You
Yeah.
continue that and it will come off. Yeah.
Yeah,
I don't
okay.
see a
Thank
major
you, sir.
problem if she has got only in the tip of the toe. Nothing to worry. Had she been injured any day?
No, she's complaining from last 3 to 4 years. Now it is,
Okay.
now it has reduced.
Okay, fine. That's good. That's good.
Yeah.
So I think management continues there. So a quick question again, and then I'm coming to Bhavna ma'am. It says that doctor, will Ayurvedic massages will help?
See, massages, they always help, whether it is a normal person or children with DS or adult with DS. But there are specific methods of doing massage. So if you want to do massage at home, please learn those methods of massage and then do. Otherwise, in spite of giving advantage to our children, you will harm them.
Yeah. Yeah. So please take an expert advice. Bhavna ma'am, please unmute and ask.
Good evening.
Good evening, ma'am.
Hello.
Thank you so much for enlightening us on this topic. And I really wish that someone had taken such a lecture 20 years back, at least 20 years back. Because as Rekha ma'am rightly said, orthopedic problems really take a back seat. My son Sahil is 25 years old. And I can't entirely say that also because we being doctors knew he has flat foot, but we never paid any attention to it. And moreover, since Sahil never complained of any problem, and in fact, he was a sports person. He was running, doing all kinds of sports, never complained, never had any problems, so never paid attention. Till last week, when I suddenly realized that I should pay attention to it.
Yes.
And I took him to a physiotherapist and an orthopedician. Sahil will vouch for it.
Yeah.
He has given us an insole, medial elevation. But obviously, he also said, and we also know that arch cannot be corrected now. So will it be any advantage to continue with this insole?
No. See, when Sahil is having pain, this medial wedges or arches will definitely.
He's not symptomatic at all. He has no problem in running, walking.
But I advocate medial heel wedges and supports because that will help in keeping the normal physiological axis and weight bearing in position. Right now, he doesn't have any pain, that's fine. But one day, if he continues like this, he might suffer from severe pain.
So what problems can we expect? We have started giving it. We have put the arches.
Pain is the only factor. Pain is the only factor. Okay. And in flat foot, there are no surgeries available. So only heel wedges and medicines will help him.
And he's also having hallus valgus. So he has given us toe separators. So should we use that also? Then it means
toe separators to be used daily.
But that is difficult to use. should we go for braces? Because toe separators can be removed. Matlab, he cannot be taught to use it without shoes. One, he has to wear shoes all the time.
Yes.
To get toe separators.
But see, what I advise to patients that, see, when these things, these supports or separators, they are mandatory to be used for our children or Sahil, then ask him to remove those separators for 10 minutes every hour. Then he will be comfortable.
So, but he cannot use it for so long. Like, he will not be wearing shoes except he's going out and wearing shoes. Matlab. Otherwise, so at home.
See, if he has to go out for 2 to 3 hours, right? So instruct him that after 1 hour, you pull your shoe out, pull the separators out for 10 minutes, then again reinsert them.
But it won't help in reversing his anatomy, no? Right?
No. See, these are all disease to relieve the discomfort that he's having. That's it.
He's not having any discomfort.
Bhavna ma'am,
but then no problem.
Bhavna, can I answer your question?
Bhavna, don't anticipate.
Okay.
Yeah, don't assume he doesn't have. They don't tell us. Let's be very clear about it. So if even there is a mild discomfort, actually the yoga socks have come out with separators. Oh. So the socks themselves have got complete separators.
Really?
So yeah, I'll send you the link. Please order them. And it's very, very convenient even when you're doing your yoga. Okay. Because they really keep the toes separate. And I agree with Piyush Bhai that you're wearing the insole support right to the end. I wear an insole. I'm absolutely flat foot. Okay. But I wear an insole and walk, and it really, really helps us. So it doesn't matter how old you are. If you need it, you need it.
Yeah,
so
we have started it. We have started it for him.
Okay, please, but don't. I mean, let's not assume that they don't have discomfort. They don't tell us, because if I ask Bubbly, do you have pain? She will just say no. But suddenly there'll be a grimace, and you can see the wincing suddenly. I mean, we have not assumed anything very much about our children, but they don't want us to be in discomfort. And that's my honest truth to you, that they never tell us very much because they're scared that we might get upset. So,
agree. He also doesn't tell if he's suffering from something, but definitely he will not do an activity which will exacerbate his symptoms.
Yeah, so
but he's doing everything. So he has no problems.
So Bhavna, if you feel that he is comfortable with this, like Piyush Bhai said, we can use the toe. Yeah, try everything. I mean, my point is, the advice that comes from doctors, sometimes we listen, sometimes we don't listen. But if we feel that it might make them comfortable, then, we need to, like Bubbly's foot size is 1, which is what is my second grandson's size. So the feet are so small, and, you assume that they can carry their body weight on those little feet. So sometimes we have to be a little sensible on how far they can walk, what they can do. And age is a very huge factor. Age is a huge factor. Like all of us, we slow down. They also slow down.
In fact, ma'am, I want to advise everyone.
Ma'am, we are overshot the time and there are many questions.
Just an advice for the younger children that we must start. In fact, I feel that I should have started this for Sahil years back because he has flat foot, we know. So children should be taken to the orthopedician and should be shown and started prophylactic treatments.
So Sammy, let's tell everybody that once a year, along with vision, hearing, you must do orthopedic. Yeah.
Orthopedic screening is very, very important, and I will come back to VP and Shikha if I get the chat box answered. Sir, we know we are overshooting time. If you allow us, we can take few more questions, sir.
Fine.
Oh, thank you, sir. So this is Sonia asking, my daughter is 15 years now. I took physiotherapy in her initial years till 5. But after that, I could not take it on regular basis. So please suggest how can we as a parent help help her for right posture. And another thing she wants to ask that in this age, also she can't jump from particular height. And cannot run as even other children with diagnosis they can run. So please suggest something.
One more point I would like to highlight. I forgot to tell. I just remembered when you told about this question. We parents are always in hurry to make our children sit, to make our children walk, to make our children run. Never do any hurries. If our child does not sit with a straight back, do not force or do not do any of that sort, that you make her or him sit besides the wall, besides the chair, with the support of the wall or with the support of the chair. These things, they harm in future. What problems we encounter at a later age, this might be the resultant of what we did initially to make them sit when they were not able to sit, to make them walk when they were not able to walk. So it is my very humble request and suggestion not to hurry at all for achieving the milestones. Not at all.
Yeah, that's a very important advice. Do not rush. Do not rush. Otherwise, we land up in problems at later stage.
At that particular time, we might feel very happy. Oh, my child is sitting, my child is walking, my child is running. But you don't know, after a few years, your happiness is going to be turned into your cry. So never rush or never hurry. Never be in any hurry to make your child sit or walk or run.
Yeah, so that's a wake-up call. Sir, another few more questions from chat. That Shubh is wanting to ask that at what age can we start manipulating?
As soon as the child is born.
Okay, it's as early as.
And that to take the advice of the expert massager. Do not do on your own. Otherwise, instead of helping, you are going to harm them.
Yeah. So true. So yeah, so we have Shubh, you want to add on? Yeah.
Yeah, I just want to certain things we just came to know after sir had been telling all those things. So now she's almost 12 years old. So I just wanted to know, can we still continue with those manipulation things when at this age? Will it be helpful, or as early as possible is good, but at this age, can we take it up?
I could not hear the full thing.
At 12 years of age. Manipulation at 12 years of age. See, is it okay?
As I told you, that before the fusion of the growth plate fuses at the age in a girl, it fuses at about 16 to 18, and in a boy it fuses at about 18 to 20, 21, right? So till the growth plate gets fused, you continue your manipulation. You continue your child's joint and muscles to be in good position, to be in good alignment. This is all to make their joints stable. When your joint becomes stable, when you do massage, when you do manipulation, then all the flabby muscles what our children have, they tend to realign to the bone. It is all the balance between the bone and the muscles and the ligaments, nothing else.
Okay, thank you, sir. Thanks a lot.
Thank you.
Yeah, I think sir has already answered this question, but still I would like to read it because reminders are always important. Priya says that my son is 8 months old and he hasn't started crawling and sitting yet. What all therapy we can do, or we can do normal massage?
Normal massage you can do. The most therapy you can do is just wait.
Wait, Priya.
Right. Sammy, I have another question.
Yeah, Priya.
So
Please
my son, when my son sleeps, his head is always tilted backwards. Whenever I try to make it forward, he wakes up and again he goes back to the same position. So that is something, if I wanted to understand, is it normal with common with Down syndrome kids, or there is something that we should focus at?
Yes, that your son is having problem when he sleeps at night, right?
No, he is sleeping well, but he sleeps with his head tilted backwards.
Yes, extended, yeah. In extended, that's what I was asking. Now, see, when he is sleeping, you cannot do anything because you will disturb his sleep. But in the daytime, when you know that he keeps his neck or head extended, manipulate in the opposite direction in the daytime. Manipulate in the opposite, not very harder, very softly and gently. You start doing this, gently touching the chin to the chest and then to the normal position. Don't do extension, only normal and touch the chin to the chest. You do it in daytime. The muscles which are not balanced, they will get balanced. And in few months of time, you will see that his head, which is in extended position, it has gradually started coming to the normal.
Okay, sir.
Yeah.
Thank you so much for this.
So another question, my Surya wants to ask, my daughter is 15 years old. Till date, she's sleeping position is like C shape. Please suggest if you can say something about that.
See, again, the C shape is actually the normal womb shape. When the child is in womb, mother's womb, it is like that only. See, the one which is comfortable position for one person, do not disturb it. Whatever you want to do that balancing when the child is awake. That your son or daughter, whoever he or she is, she needs extension of the spine. When she sleeps like this in the C position, she needs extension right from the cervical region to thorax to the lumbar region. So make her do all those extension exercises in the daytime. But if you will try to disturb that C position right now, her sleep will be disturbed.
Yeah. So last question from the chat, and then we come to the hand raised. Those are repeaters asking question. It is by Anita. She says, can we buy insoles off the shelf, or do we need to consult a doctor first?
See, you know the measurement of the foot of your child. So whatever the insole that fits in, you buy from the shelf, no problem.
So Anita, so Vicky, I think
nowadays all the instructions are given along with the all insoles, the leaflets, the information in the leaflet that is already given, how to wear them, what to do. So it becomes an easy thing for all of us now.
So
I have one question, Sammy. I have a question.
Please, ma.
Yeah. Piyush, do we have anybody called a podiatrist in India?
What I couldn't hear.
The podiatrist, a person who looks at your foot. Yeah.
Yeah. See, there are ankle and foot surgeons many in India, but particularly for Downs, I'm not sure. I don't think there is any.
So we need to create a group of podiatrists who will be able to handle exclusively our children.
Yeah, I can be a good podiatrist, no problem.
Yeah, thank you so much. We need a podiatrist because, you know, all these questions have to be answered by a specific way, you know. Thank you.
Yeah.
Okay,
yeah.
So.
Yeah, Vicky, unmute.
Yeah.
Yeah.
Piyush sir, about the foot arc, median foot arc, which is it. Okay, our kids all, and in the photo also I saw the arc is, I mean, they have a flat foot, but I mean there are kids who have a arc. It's a collapsible arc, so it's like when they are doing activity, it's a flat foot. Otherwise, when they are sleeping, the arc is clearly seen. So is this really a flat foot? Can this be also be adjusted as a flat foot, or diagnosed as a flat foot?
All the unstable or deformed things in our children, they are always fully corrected. Even if your child has a flat foot, if you just put in your thumb like this, it will be a normal arch because it is that flexible. These all deformities, they are all flexible like this. So now you have to decide what activities you are going to do for your child.
Right.
If it is heavy, then don't go. If it is jumping, if it is running, then go for collapsible ones. But if it is just walking, then go for the rigid ones.
Right, sir. And sir, about the braces, which you said that for running and for some jumping activities, we should, you know, it is always better to give the kids braces. What are the ages we should start from giving the braces? One. Second thing, and by the braces you mean as in, are you talking about the socks or the?
No, see, I am not talking about socks.
Knee sock.
If we consider knee joint, so there are braces available like elastic knee support with hinges.
Yes, sir. Yes, sir. Yes, sir. Yes, sir.
So the weight-bearing axis will always move on those hinges rather than the joint itself. So the joint will be well protected and they will be able to move their knee normally like this.
Okay, sir. But with because my child is a toddler. I mean, she's still a 6-year. Will she be able to, because she would want to do multiple activities with, you know? So for us to understand, because this will again, if I put the braces, won't it restrict her activity? Because
in fact, it will increase their activity.
Okay.
They are not, see, by putting in all braces, you are not restricting them, you are protecting them.
Right, sir. Right, sir. That's what. No, because I also understood that is because that extension.
For all our children, vitamin D3 and calcium are most important.
Yes, sir. I remember. Yes, sir. I remember. You have been always forgetting that.
Vitamin D3, 60K to be taken weekly for 2 months, then 60K every month for 1 year.
Yeah. Right, sir. Right, sir. And sir, one last question. Sorry, ma'am, one just last question about sir, the hip thing which we are talking about, scoliosis and other things. Okay, if we make them do hanging activities, more, you know,
you can promote those hanging activities. They are all time better, but see that their finger grips are well.
Right, sir. Of course.
On the bar, if their finger grips are loose, they tend to injure themselves. See that the finger grips are good, there is a good muscle tone in the fingers, then only allow such activities.
But sir, won't that increase the chances of dislocation with the shoulder, because they don't have muscle control, as you said, because they are very prone to, you know, sorry.
That's what I told, every day in and day out, do not forget to do exercises for that.
Okay, sir.
If they can do their exercises on their own, let them do on their own, but make it a routine. As we eat, as we brush, as we sleep, exercises, they are the integral part of lives of our children.
Absolutely, sir. Absolutely. Thank you, sir. Thank you.
Sir, the questions will keep coming. They will try to do it in one-on-one. So we would request if we can share your number or any platform where they can connect you for your opinion.
I'll just write down my number in chat box. Anybody who wants to ask, please do so.
Yeah. So
I shall be very happy to answer all the questions. And actually, this was just the information which I shared the information. There was nothing like a lecture. There was nothing like a teaching, because I know that I can only share my experiences, what we have done for my palak. And I have shared my number.
Yeah. So parents, you can note down the number from the chat box. Sir, if you can just repeat about the intake of calcium and vitamin D3 medicines, age appropriate, or it's a journal dose?
I tell you, after say when the child they start walking, when you see the stance, some they have got bow legs, some they have got knock knees, some they have got difficulty in the spinal cord region. So vitamin D3 is essential for all, irrespective of age. After 3 to 4 years, when they start walking, vitamin D3 60K, that is 60,000 units every week, one sachet with a cup of milk every week for 8 weeks. That is 2 months. And after 2 months, one sachet with milk once a month for the whole year, that is 10 months. Then take a break for 3 months. Then again, you can restart the same schedule next year.
So I think today's lecture was a really wake-up call for every parent.
It was information. It was not
Yeah, नहीं, it has to be in their agenda to get
Yes, sir,
reviewed.
वो समीक्षा को लेक्चर ही लग रहा होगा, इसीलिए वो बार-बार लेक्चर बोल रही है.
नहीं, it's a wake-up call. Why I'm saying, because prevention and management we forget sometimes, because the pain threshold I think is so high, or they do not communicate pain, or they process pain very differently. They do not express it the way I do. Like, hi Ram, मेरा तो सर दर्द हो गया, दिन भर I'll keep chatting. They might not do that.
It's so amusing, Sammy and Parul, that Piyush Bhai has come in at the time when Bubbly had an accident. And it was amazing that when I heard that we're going to be talking about issues of, because we're normally talking about everything else except orthopedics. I don't think we have ever talked about bones and the body structure and, whatever it was. So thank you so much, Piyush Bhai, for being, and we're going to call you back again and again, because I think there's a huge demand for you. And please get us more people who will be able to assess the foot and help all our children, because tomorrow's children are going to be athletes, and we would like them to be, in every field and not restrict their movements. But thank you so much for giving your time.
One more thing I'll tell from my side, that if we have some serious orthopedic issues in our children, I have got some special pediatric orthopedician friends who can enlighten with the in-depth knowledge which they have. Because I practice pediatrics, I practice all adolescent and adults in geriatric, but the one who is specialized in pediatric orthopedics can throw more light to us as well. So if anyone has serious orthopedic issues, I can always call them like today, and he can always throw the light on all the issues.
Thank you so much, Bhai. All you have to do is to give us their numbers so we can also put them onto our group of specialists.
Okay,
it will be very important for us.
This weekend, I'll talk to a few of my friends and we'll let you know.
Thank you so much, Bhai. Thank you so much. God bless you. Really, God bless you.
I'm honored. Honored.
Yeah.
Thank you so much, sir. And I'm sure your phone will keep ringing now every hour. And our parents who are today here are going to, and I would request all the parents, if you come up.
I'm going to put my ringtone called Samiksha and Parul. Samiksha and Parul. Samiksha and Parul.
Yes, sir, you can do so. Thank you so much. Parul.
Thank you so much. God bless you. Bye.
Thank you all. Love you all. Fine.
Yeah.
Thank you, everyone. I'm ending the session now.
Yeah,
Bye.
See you on next Saturday. Bye-bye.